Empty room. Boom, 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 boom. Blank sheet of paper. Okay. How do I flip the camera? I don't know how to flip the camera. Let me set it up. That's good. Hopefully you can see. Okay. Chords. Divisions. Trunks. Roots. C5. C6. C7. C8. T1. Antennas. That's the long Thor. Why did I do this in pen? Why did I do this in pen? He shoots it in pencil because I can't deal with the fact that the ink's running out. Thoracic nerve. Radial nerve. Ulnar nerve. Nerve. Auxiliary nerve. 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 Lateral cord. And this one is posterior. This one is the medial. One, two, three, 4, 5, 6. Okay, now it's time to do. I can just leave that paper there. Okay, let's go. On your phone, recording nerd. Okay, all right, relax. Close. Forget the lower bower. Come on, this way. Okay. Come in. You can come in. Okay. First, I'd ask for you record me in the video.
Mm-hmm.
How are you so far? Just like right there. That's fine. So I'd ask. I'm checking for past, present history, OPQRC, onset, provoking factors. Q, quality of the pain, R, radiation, S, severity, T, time of the injury, like how long ago. Then sample, so signs and symptoms, like what's wrong with them. A, allergies, M, medications. P, past/present history. L, last oral intake, and then E, events leading up to the event of the injury. Then after we do all that, first thing we do is we check for swelling or discoloration or deformity and posture. Then we check if the scapula is winging. Right here, just check if the scapula is winging. Okay, go ahead, go back over there. Make sure the shoulders are equal. Stand up, arms hanging, shoulders equal. Okay, then sit down. I'm looking for atrophy and hypertrophy. And then we do the bony palpations. So make sure you come closer so you can see this. So the clavicle, right here. Then the sternoclavicular joint where the sternum and clavicle connect. Then the acromion clavicular joint, the AC joint, then the humerus head and the bicipital groove, and then come back here. We have the scapula, and we're looking at the medial angle, inferior angle, medial border, lateral border, supraspinatus fossa, the scapula spine. Okay. After we do all that, we're going to check the rotator cuff muscles now. Oh, and I almost forgot, on the scapula, we have the acromion process right here and the coracoid process. Okay, go ahead and now we're going to do the muscles. So we have the supraspinatus right here. I can come back over here. Supraspinatus right here. Infraspinatus below, the teres minor, and the subscapularis we can't palpate. It's too deep, so we can't palpate that. Then we have the anterior deltoid, posterior deltoid, middle deltoid, the levator scapulae, the serratus anterior, the biceps, the coracobrachial, the biceps, the coracobrachialis, the pectoralis major, pectoralis minor. Come back here. Turn a little bit. The rhomboid major, rhomboid minor, trapezius upper, trapezius middle, trapezius lower. And then the last thing is the latissimus dorsi, so winging down the back, pretty much all the way from the shoulders all the way down to your lower back. Okay. Now we're going to do some active range of motion, easier than passive range of motion. So go ahead and do flexion, 180, extension, 60, abduction, adduction, horizontal abduction, horizontal adduction, adduction, and then shoulder elevation, shoulder depression, shoulder protraction, shoulder retraction. Okay, and then internal rotation, also known as medial rotation, external rotation, also known as lateral rotation, more like here, go ahead, medial, and then external. Okay, then we're going to do restricted range of motion. So first we're going to do flexion. So I grab on the trunk, go ahead and do flexion. Yep. And that's the pectoralis major, anterior deltoid, and the biceps working. And then we're going to do extension. Go ahead. And that's working. You can get closer for this. Extension, that's working. So go ahead and do extension again. That's working the latissimus dorsi, the teres major, and the posterior deltoid. Okay, and then we're going to do the abduction, abduction. So you want to take a step back. Go ahead. Come on, put some force into it. Feel like you're not putting anything into it. Okay, that's working the middle deltoid, the pectoralis major, or not the middle deltoid, the pectoralis major and the latissimus dorsi. Then we're going to do adduction. That was abduction, now adduction. Okay, that's working the pectoralis major and the latissimus dorsi again. Now we're going to do abduction, work the deltoid, middle deltoid. Hold on, let's do that again, because go ahead, abduct. That's the middle deltoid and the pectoralis major. Now adduct. That is the pectoralis major and the latissimus dorsi. Mixing those up. Okay, and then now we're going to do internal rotation. We'll do internal rotation first. So start like this, internal rotation. Okay, good. That's the pectoralis major, and the supraspinatus and latissimus dorsi and the teres major. Then we're going to do external rotation with restricted range of motion, RROM, and that's the infraspinatus and the teres minor. Okay, and then we're gonna do horizontal abduction. Okay, go ahead, abduct. That's the posterior deltoid and the latissimus dorsi and the teres minor, and then adduct. Go ahead. Sorry. That is the anterior deltoid, the pectoralis major, and the coracobrachialis, which that's the only function for the, go ahead, relax, the coracobrachialis. And now we're going to do ones without restricted range of motion because it's hard to restrict the shoulders. So we're going to do shoulder elevation. Just, yeah, yep, shoulder elevation. We're going to do shoulder depression, or shoulder elevation, which is working the trapezius and the levator scapulae we talked about earlier. Helps raise your shoulders. Scapular depression, or adduction, more like it, middle trapezius and the rhombus major. And then we're going to do scapular depression / adduction, so back and down. That's lower trapezius, and then we're going to do the scapular adduction / downward rotation, which is the rhomboid major and the rhomboid minor. Okay, and then after all that, we're going to test, come over here, right here. This is, got it, okay. We're going to test for sensory, no, first we do motor tests. Okay, so deltoid, checking the deltoid, that's C5. Then we're going to do C6. C6, wrist extensor, that's C6. C7, wrist flexion / trap. Okay. iPhone storage decided to be a piece of garbage. So, C7, or no, let's restart that. Deltoid. Okay, cool. That's C5. Then C6, it's wrist extensor, traps, and wrist flexion and wrist finger extensors. That's C7. Then we do C8, finger flexion, and then abduction of the fingers is T1. Okay, and now we're going to do sensory. So C5 right here, C6 right here. We're just checking if it feels the same on both sides. We compare bilaterally. C7, C8. So let's do that again, because it keeps C5, C6. I'm on a time limit, I guess. C7, C8, T1. Okay, and then we would check for reflexes. So relax, boom, hit there with the reflex hammer for the C5, the biceps tendon, and then right here, brachialis. You have to turn like that, and then boom, hit there. That's C6. And then for C7, relax, right here. Come back here. See, you're gonna hit here with the reflex hammer. That's C7. That's the triceps tendon. And then we check for radial pulse. Okay, I'm on a time limit. Let's say we do this for 15 seconds, and we check their pulse for 15 seconds. Say it was 18. 18 times 4, that's 72. So we would say 72, strong, regular. Then we check for recapitularization. See, it should go red after 2 seconds. Good. And then we would compare bilaterally. All right. Thank you.